Ladies and gentlemen, we'd like to start, please. Would you mingle at the tables, if you could? And if we could have panel 1 participants to my right and panel 2 participants to my left. So panelists, please, panel 2 participants over here. I see some of them back there. Please come over here. Katie, please call them up by name. And panel 1, please come over here. It'll just make things so much easier for the moderators. Thank you very much. So I'd like to welcome you to the Graduate Institute for International and Development Studies. My name is Ilona Kickbush. I'm the director of the Global Health Center here at the Graduate Institute. And over the last years, we have started to become more involved in digital health. And I'm happy to let you know we're in the very I don't know, it depends on the perspective, first or last phases of setting up a Lancet Commission on Governing Health Futures 2030, Growing Up in a Digital World. So it's within this context that together with our partners here, with the Novartis Foundation and with PATH, and with Global Health 2030 Innovation Task Force and the Global Digital Health Initiative 2030, we are inviting you to this event, which on the one hand will just give you some glimpses of this important agenda, the role that digital health, the digital transformation, the digital dynamic plays in relation to Universal Health Coverage 2030. And that, of course, is absolutely critical given the high-level meeting that will come up this September. And some of us feel that the whole impact, nature, and importance of digital health might not yet be reflected enough in what we have seen of some of the preparatory documents. So this is an important point in time where we can make some of these points, where some of you will contribute based on your experience, but also looking forward what you are planning to do in this really important field. It's our particular pleasure, we have to say a very big thank you, and I think my co-moderators and the other partners here will underline this, that we are very thankful to Dennis Julhuli, who helped set this up, who brought you all together, and I think we should all give a big clap and say thank you to him. So it's my pleasure now to ask Anne Ertz from the Novartis Foundation and Steve Davis from PATH to please come and give their short welcomes.
Thank you, Ilona, and welcome, everyone. Thank you for coming. Welcome, ladies and gentlemen, excellencies, and it's a real honor and pleasure to be here tonight with you. And I think this dialogue here tonight is the most important one of WHA, and I'm not biased. It's just because digital has to be part of every health system in the world. It is the opportunity we have to transform the way we address health and care for the populations. It's the opportunity we have to transform the way we deliver our services in the world. And systems that are currently struggling to address the enormous scope of global health challenges we have to modify really drastically or radically. This morning was the word, a radical change in our health systems of how we address the needs of the populations. We have to make our health systems that keep our people healthy instead of waiting until they get sick. We have to transform them from being reactive systems to becoming proactive. And even with AI and precision medicine, we can make them predictive. That is how health systems will have to evolve in the coming weeks, months, years, in the 21st century at least. And That is also one of the reasons why within the Broadband Commission for Sustainable Development, where I co-chair the working group on health, together with Microsoft, we are launching a new working group this year and specifically looking at how AI can do that transformation, making our health systems proactive and predictive. So we will gather with a whole group of world-class experts, both in digital health, from the tech industry, from the healthcare, from other sectors, and work together with civil society, patient associations, academics, and other partners to distill what are the best solutions we will be able to use in our health systems moving forward. So I'm very excited for the dialogue tonight, and I look forward to a very interactive discussion. Thank you so much. Steve, please.
Well, let me add my welcome to everyone tonight. I can guarantee you I'm the West Coast United States technology guy that shows up without a tie and promises you a relaxing evening tonight, and informal and a little bit of creativity as we go too, because we're out changing the world. Now, I have gotten in trouble a number of times for suggesting that maybe biology and chemistry don't matter that much in health anymore, which I, of course, don't agree with, because there's an enormous amount of innovation and revolution in those areas as well. But I do think, and we talk a lot about the next decade being transformed more powerfully by how we use data and digital tools and digital analytics and other things more capably. And that is really the extraordinary decade ahead. To that end, my own organization, PATH, which has been around doing a lot of innovation in health for over 40 years, has recently recommitted to a new strategy to help support the SDGs, 1.4 billion people we want to reach and improve their lives over the next decade, and with many focuses, but one of the most important is really prioritizing our work in data and digital excellence. And to that end, we've recently just announced a center for a center of data and digital excellence, and really powering that up with a lot of great capabilities, tools, all the way from how do we support governments in their digital transformation strategy and work, to specifically thinking about the world of the Internet of Things, to work with the analytics and private sector engagement in global health writ large. So we're quite excited about that. And I would like to mention that my colleague, Dickie Settle, who many of you know very well, has been appointed to be the director of that center. So thank you, Dickie, who did a lot to organize tonight. Thanks, Dickie. So with that, and because we have a lot of engaged and interested people, we're going to go right into the panels. And so we've decided to structure this in a fast-paced, and I say that again to all of you, a fast-paced conversation where Anne and I and Ilona are going to take turns sort of spinning some questions to first our panel over here, and then later our panel over there, and we'll go back and forth a little bit, and really trying to get at what's exciting in digital tools and technology, what are things that are happening for us to be working more together on, how does this all tee up into what the World Health Assembly and the WHO and others are doing. And so with that, I'll turn it first over to Anne to ask the first question.
Right. Is this one working? Yeah. I thought we were going to start with WHO, with Bernardo, who is the host here tonight at the World Health Assembly, and just came out with a digital health strategy for WHO. Would you like to tell us a word about that, Bernardo?
Thank you. As Dr. Tedros said when he announced the creation of the Digital Health Department, digital health is the future of health. And he told me, Bernardo, you're going to be helping to establish WHO in that framework of the future of health. And of course, to do that, partnership is key. Collaboration is key. And the ecosystem of healthcare, as it goes through that transformation, similar to the good digital transformation of other ecosystems such as finance, and learning from the experience of not so good transformations on digital, such as the media sector. We want to make sure that the trades and the signature of health, quality of health, and essential health services for all remains at the core, at the center of that transformation as we embark in that digital journey. So WHO established last year, the member states tasked WHO to prepare a global strategy on digital health. And that's what we are working on, and we had just finished the global consultation, global public consultations on that, and we're gonna start our internal revision within our member states at the regional committees. But also, we also started working on the action plan. Of course, the world doesn't wait until WHO has its own strategy. The world keeps moving. So we have to work in both ends. One, to ensure that we don't miss the opportunity to ensure that quality of health is delivered as we bring new tools on AI, either is AI-based or other technologies. And of course, within that perspective of tools that are AI-based, there are issues such as ethical. Data is a big one. So maybe I'll just focus on data. For the sake of time, I will not go around, but I'll just focus a little bit more on the data side. The AI and data, basically, data is currently considered perhaps a new gold or new blood, if you're going to talk about health. And the question is, how do we ensure that as those AI-based algorithms that feed on data that is data that is mined from all of us, how can we ensure that the quality of health improves, the access of health improves, and affordability of health improves? So accessibility, affordability is key. And of course, we don't want also to have the Novartis and other companies run out of business because of intellectual property. But on the other hand, we just, as per the Sustainable Development Goal, we don't want to leave anyone behind because they can't afford to pay for medicine or for access to essential health. So it is within that perspective that both the strategy and the work that we're doing with a lot of our partners, some of them are here, we're really trying to strike that balance of how do we make sure that we deliver health for all at highest quality, and we leave no one behind. So at this stage, I think I stop here.
Thank you, Bernardo. And we will, it works. We'll be hearing more from folks at WHO and others as we go on. We're very honored tonight to have the Minister of Health of Trinidad and Tobago here. And he is offered to give a few thoughts. And tell me what's the most exciting thing happening in your country around digital health.
Well, first of all, good afternoon, everyone. Does everyone know where Trinidad and Tobago is? Yes. Everyone does? Who doesn't? Let me see your hands. Okay, great. So the most exciting thing happening in Trinidad and Tobago with digital health is that nothing is happening.
Uh-oh.
So
Bernardo, you got to pay attention here.
So it means you have virgin territory.
Oh, great.
Folks, Trinidad and Tobago is a population of 1.3 million people. Our biggest medical crisis is NCDs, non-communicable diseases, lifestyle diseases, which kills about 70% of our deaths before the age of 70 are premature deaths due to NCDs. That's the crisis we are facing. The model of delivery we have used in the past is build hospitals and treat them. Build it and they will come and treat them. We are trying in Trinidad now to turn that model upside down to the preventative care. We see digital health as AI, as the business lecturers will tell you, and we are in a business school, as this great big disruptor to change the status quo of how we deliver healthcare. We must change the status quo, because if we don't, you will not be able to build enough hospital beds and give enough free hospital beds to patients when they present with these diseases. In upsetting the status quo with AI and digital health, we are hoping that with AI, we could develop some algorithms to help with development of best clinical practice, to guide our doctors, to guide our consultants. And then with digital health, to use the smartphones to deliver health advice to patients. As medical practitioners in the Caribbean, one of our biggest problems is that patients are not compliant with medication. They simply don't take their medication or take them in a haphazard way. We want to start an experiment with reminders. Did you take your medicine today? Did you take your diabetes medicine today? Did you exercise today? Did you eat ice cream today? And if you did, how much? Because that's a no-no. As I will close this first part of my presentation, we in the Caribbean have serious genetic and cultural problems with NCDs. Our East Indian population descended from Indian indentured laborers like myself that you find in Trinidad, Guyana, Suriname. We are genetically prone to diabetes. Our Afro population descended from slaves. They are prone to hypertension. When you marry that with our cultural likeness for food and the wrong types of food, what you have is a time bomb that has exploded. Not waiting to explode, has exploded. And we can't do the same thing the same way. So we see digital health and AI as a disruptor, as a cost-effective disruptor to challenge the status quo and to get us in a different model of healthcare. Thank you very much.
Thank you so much. This is exactly what digital health is supposed to do. So we have the honor also to have Mark Davis with us, who's the Chief Medical Officer of IBM. And I wanted to ask you, Mark, what do you think is the biggest challenge for countries like Trinidad and Tobago to start with it, to launch digital? Is it the difficulty of choosing what to start with first? Or also, what do you think will have the biggest impact with tech on healthcare?
Okay, thank you for those two big questions. You told me to be brief, and then you've asked me two really complicated questions.
It's one question.
First thing I want to say is well done everyone for standing up. Just fantastic. You know what? Smoking, I mean, sitting is the new smoking, so you're all doing a massive campaign for public health. You should be congratulated. Yeah, that comes next. That comes next. So, I'm a physician by background, work with IBM across Europe, Middle East, and Africa, so I get the great privilege of working in lots of different countries, having lots of discussions around digital health. And you know what, my dream is that we stop talking about digital health. You know, no one talks about digital media anymore. No one talks about digital photography or digital music. We talk about music, photography, and media. And when we've reached the point actually where we no longer need to qualify health and indeed well-being using the word digital, folks, we will have arrived. And I hope that we're going to see it in my lifetime. We are absolutely going to see it in my children's lifetime. To your point around getting started, it may seem and it may feel, and I know, and I've had lots of conversations around the angst around communities that are earlier on in this journey rather than those that are further on. But you know what? It's not all bad, because actually being a long way down the journey comes with a whole set of issues. So legacy, I'm not just talking about legacy IT systems, but legacy ways of thinking, siloed methods, which have become really well ingrained, and dare I say it, a set of governance rules often, and a set of regulatory regimes that were cast in a world that was 20 years ago. So often some of the challenges that we see in countries that are further on and more mature, so-called in their digitalization, is actually to create this kind of disruptive leap, not in terms of running healthcare better, but in terms of redesigning and rethinking healthcare, so you might actually be in a better place. Yes. So there's great potential to leapfrog some of the current incumbents. And I think, and for that reason, that's one of the reasons why I find the global aspects of this conversation so exciting. I cannot think of a more noble aim than making health and well-being fairer as well as higher quality, more sustainable, and financially sustainable. To your point around where does the big bucks reside, it is difficult to think of an area of healthcare that isn't going to be touched by this transformation, whether that be teleconsultation, telemonitoring, thinking about your surplus, your supply chain, thinking around how you train the next generation, et cetera, et cetera. But there are two things that I think are massively exciting. One is the capturing the power of the individual and the power of communities and creating, offering digital platforms and apps that are going to allow people to be equal participators in defining their own goals and creating the kind of nudges that are going to drive compliance in the way that you were describing, and be able to take responsibility in a way that, frankly, we have taught the talk, but we've not had the digital capability to actually make it a reality. We now have, and I think that's going to be transformational. And the second is, it won't surprise you to hear me say this because I work for Watson Health, but it's the application of knowledge, the democratization of knowledge. So using machine learning and natural language processing to put in the pockets of ordinary citizens, of primary care physicians, the best expert opinions that they can have in a way that's actionable at the point of care. That result, in that world, we start to drive that unexplained variation, and we start to democratize the knowledge that drives our industry. So heady and exciting times.
Thanks, Mark. That's great. And so very happy to welcome Dr. Precious Masoso from South Africa. And in the post-digital world, since we're not supposed to use digital much anymore, so how do you see it coming together between the private and public and social sectors and leading to an UHC 2030 from the South Africa perspective in digital?
Well, good evening. I thought you'd start by saying, how can we digitize better shoes for ladies if we're going to stand for hours?
I've always thought that was a problem.
But thank you very much for inviting me. I think this is opportune because we are just on a path and brink of implementing national health insurance, and we've said a couple of things have to happen. Firstly, we have to get our information right, and secondly, we have to embed quality in UHC. So the first, with regard to getting information right, we said perhaps we have to think out of the box. I wouldn't say necessarily that it's leapfrogging. It was just about saying who in South Africa has the best information and in what form is that information. We looked at information that is owned by different service providers, which is the mobile technology industry. We looked at other registry initiatives, whether they're used for voting and other, the banking system and so on. So we actually assessed all those sets of information providers and looked at how we could leverage on that. And what we did, we also went manual. I mean, manual in a sense that we bought almost 10,000 computers and installed them in fact, we have surpassed that number now. Now to buy 10,000 computers and try and install them in every single facility. I sort of equated that to buying a car and keeping it for 5 years, because that's the number of kilometers we had to travel to install those computers. Wow. Meaning we're in a digital environment, but we're still using old methods of implementation. We have actually installed these in over 3,000 facilities, but you can imagine how long it took us to travel across the country just to install in every single facility. Secondly, we had to train and change mindset. But of course, South Africa has some rural parts where you don't have connectivity. So we had to, work with the service providers to say what are innovative ways that can be considered, where people don't have to travel miles to get data and so on. So where we are, we've loaded, we've registered about 41 million users.
That's great.
But no, that's the only thing we can say. So the argument has been, what do you do with registering 41 million users? It's not enough. We need to do something else. So we've then gone to look at all the systems. We split them into two. One is information regarding our health systems performance, your HR info, your procurement and others. And of course, because we've started the process of introducing what I call apps and mHealth, we said we look at all those systems. But secondly, information regarding individual, clinical information regarding patients. So we've got those two streams of work. But we are saying we don't want to reinvent the wheel. We want to look at systems that can be used elsewhere. And perhaps that would be the best way. In the private sector, they are trying to test some ideas about AI. And in 3 of the facilities where they are testing, they want to use a facility where people can just go test their blood pressure, do their BMI, and so on, and see whether that can be the basis on which people can take responsibility for their own health. But we have not tested that. It's still on pilot basis.
Thank you.
Thank you so much, Dr. Preciosa. And I think these are very realistic challenges when we want to implement digital and scale it. So I wanted to ask you, John, from Broadreach, your organization is very active in Africa and many other smaller nations like island nations. What are the main challenges you see on the ground when you want to implement solutions at scale?
Sure.
Well, you can have this one.
Okay.
I'll take it.
Sure. Okay. Thank you so much. So by way of background, I'm a medical doctor turned management consultant turned social entrepreneur, and my best friend from medical school, Ernest Darko, back there is a fellow co-founder of Broadreach, and for 16 years we've been fortunate to be working on the ground, working on the improving health systems. And so I think our colleague from South Africa actually, I think, gave a great description of the real life challenges, the infrastructure, the mindsets, the beliefs. But I would maybe take it one level further and say that at the end of the day, technology and digital health, whether we use that after today's meeting or not, is a means to an end and not an end in itself. And what do I mean by that? If we are truly going to transform how healthcare is delivered, it is massive change management across an entire industry, across populations. And this is something that my fellow co-founder Ernest talks about a lot. But think about, what does it take to get one person, one pill, or one child, one immunization? If you look at that entire ecosystem, from the government to regulatory environment, to providers, to supply chain, to pharmaceutical providers, to doctors, nurses, community healthcare workers, to the actual patient itself, every single piece of that ecosystem needs to change how they're thinking, whether it's thinking about how I'm going to eat better, whether it's how, as a community healthcare worker, I'm going to interact with patients much more differently and start treatment, whereas doctors used to do that before. But it is change management at an unprecedented scale. And so the devil is in the details. An app will not fix this. There is a lot of hard work that's going to need to be done. So I think in our experience, this is the hardest thing. I mean, technology, for the most part, we can fix those things because they're sort of, we can figure it out. Changing behavior? No. I started exercising after New Year's Day every single year, and it works for a couple of weeks, and I stop. Right, exactly. And I think that the second thing, I think, Mark, you touched on this, is that Henry Ford was famous for saying, when you ask people what they want to build faster horses, right? And that is based on the fact that we have a very siloed and limited thinking based on our experience. So as a doctor, I'm very unimaginative, and I'm sort of thinking that sick people, healthcare is sick people coming to me in a clinic, and there's a ratio of a certain number of patients to a certain number of doctors, a certain number of nurses. And so what we often find is not knowing what we don't know is a big barrier to implementation, because then the questions are, can we use AI to speed up this process and make it more efficient, as opposed to how do we use AI in digital health to actually disrupt and change the entire care model? So I think at a very high level, those are the two areas. Thanks.
John, thank you so much. And we have the honor to have State Minister Patrick from Rwanda, who just joined now. And Patrick, Rwanda is such an example with visionary leadership on how to digitalize its whole economy. So if there's one thing in the health sector for Rwanda that you would like to digitalize or to accelerate with digital technology, what would it be?
Thank you, and good to see you again. Thank you all, and I'm very impressed by the number of people attending. And to echo my predecessor, it's a revolution that's happening. And it's very hard to realize that a revolution is happening where you're looking. As he's saying so rightly, we also need to change the way we educate, because the way we teach medicine will have to change if we have this artificial intelligence. So if you ask me what I want to change in Rwanda, I want to change everything. I want to change everything, but because things happen one step at a time, now what we're looking into is at least to have all our 13, 14 different health systems being interoperable, being able to follow up a patient from the community to the tertiary health facilities, and especially be able to link some of the activities that we do in NCDs at community level when we go out there and test people, to be able to capture that data and be able to follow it over time. Those are the things that will be extremely useful. As much as we focus on the care and treatment, I think what the digital solution will provide us with is preventive measures that will allow us to detect early and treat early. So primary and secondary prevention, and I think that should be the focus, because that's what will cut all the costs down, and that's what will help us actually have sustainable health system that makes us reach the universal health coverage. Thank you.
Well, thank you, Honorable Minister. And I think this is a testament this evening to this revolution is so big. There's a lot of great ideas. But I'm also going to have to play Henry Ford here, which is to ask the horses to move faster, because we've got a lot of great people who want to speak. But it's really my honor to my friend, Dr. Oli Ilunga from the DRC, who is here. And you've had an extraordinary year. And can you just give us one glimmer of how digital has shaped the challenges you're facing?
Good evening, everyone. For us, the digitalization is really an opportunity to change the paradigm in the healthcare system. I think it's an opportunity to have more accountability in the healthcare sector. It's an opportunity also to give people access to knowledge. I think that healthcare is about also diagnosis is all about information, knowledge management, and digitalization can really help us to improve to build up the capacity of the healthcare workers, even in the remote area, to give them access to knowledge. It's an opportunity also to make them part of improving knowledge in the healthcare sector, because they can be part of study, clinical trials, even in remote area. I was really impressed 2 years ago when we were traveling in the country. There was a clinical trial underway about the sleeping sickness. But it was very interesting to see that even in a really remote area, nurses were gathering data on an iPad, and they were sending all the information in a big database, and they were contributing to improve our knowledge on the disease, our knowledge on the effectiveness of new drugs. So for me, really, it's also a game changer in the way we think, we see the healthcare sector. So we are convinced that the future of healthcare is in digital. Is the only way if you want to give people access to good healthcare, to give them access to quality, to give them access to expertise, because with telemedicine you can give people, even in remote area, you can give them access to expert doctors for diagnosis, advice on treatment, and so on. So for me, I see many, many opportunities with digitalization. Thank you very much.
Thank you very much. It's a really beautiful story, and especially coming from your country with so many remote areas that are difficult to access. It's fantastic. So let us conclude this panel with hearing the voice of ITU. Malcolm, I know ITU is now working very closely with WHO to make sure that we can make this a reality, digital health, also using the latest technologies. So can you tell us a little bit about that collaboration?
Can I take that? Yes, thanks very much, and good evening, everybody. Well, digital health, it's only right, I think, that ITU is standing next to WHO, because ITU is the lead UN agency for information and communication technology. So clearly, we have a close and growing partnership in this area. We organize the event that we hold at ITU just across the road each year, AI for Good Global Summit, which will be held here next week. So everyone's invited. If you would like to spend a weekend in Geneva, come along to that next week. It's going to be a very interesting event in the conference center in Geneva. But last year, it was focused on AI for health, and we had Dr. Tedros speaking there. And subsequent to that event, we established a focus group on AI for health. So we're doing quite a lot of work now looking at proving that the AI algorithms for different health issues are effective before they actually implemented. And also looking at, I mean, AI is only as good as the data it's got to analyze. And so one of the problems that apparently is quite prevalent is the lack of interoperability between databases, that health databases, even within the same country, there's a lack of interoperability. So that's been looked at as well. And we're also developing standards jointly with WHO, and we launched the first one a few weeks back. I was pleased to join Dr. Tedros in launching a standard to help young people protect their hearing when they're listening to the music too loud, you know. So that was launched at WHO recently. We're doing more in that area. But the thing to remember is that we've got all these benefits of this technology available to the people that can connect to it, you know. And we know that from statistics that it's only just over 50% of the world's population actually is connected to the internet. So half the world's population can't benefit from this technology. So the critical thing, if you're going to have universal health coverage, is to provide connectivity worldwide. And that's the big challenge that we're faced with. And a number of innovative technologies coming along, which we think will help in that area, in particular low Earth orbiting satellite systems, high altitude platforms, and 5G, of course. 5G is going to be expensive, but they have a tremendous capacity to handle this data. And it can be implemented even in the remote and rural areas where there is a lack of coverage if you connect the 5G with a satellite, you know, the satellite for the backhaul. So we are involved in quite a few projects where we can have a cellular network in a village connected to with a backhaul through the satellite network. So hopefully that we do bring this technology to everyone very soon.
Well, thank you, and it just begins to just uncover a little bit the richness of all the work that I know so many in the room are doing. So let me ask all of us to give this panel a big thank you for your participation. And I'll turn it over now to Ilona, and she's the moderator, although Ann and I can help out as needed on the next panel.
Thank you, thank you. We're talking all this digital. I think we still have bodies. So you've been standing for quite some time now. Do you think you might want to stretch a bit and sort of move about a little bit so that you feel better to stand for the next half hour or so as we move to this wonderful next panel? We thought we'd take up the issue of linking many of the global digital challenges with universal health coverage. And of course, we're in this era of transformation. The SDGs say we have to transform everything. We talk about the digital transformation. WHO is transforming. And of course, universal health coverage on primary health care will also, we've heard it from this panel, need to change. We need a totally new understanding. And meanwhile, we have these major challenges around the NCD tsunami, around health workforce. So we have a whole set of wicked problems, some of which digital can help resolve. But also we have to be very careful in the sense that we also don't expect too much from a technology what is not really a technological issue. And I see that sometimes perhaps the discussion is going in that direction, that solutions we haven't been able to approach politically, we're now hoping that the digital transformation will resolve for us. That's why I thought I would take the first question to Dr. Abdullah from the government of Malaysia. You were a pioneer in Malaysia. You started over 10 years ago with your digital transformation. What are 3 lessons you would like to leave with us?
Thank you very much. Good evening. First and foremost, I think from our experience, we know that healthcare today will be driven by quality of care, and the future of healthcare will be riding on digital health. But we started much earlier than that. We started way back in 1997, whereby our Prime Minister, he has Tun Dr. Mahathir then, he has the vision. I think it's 20 years much earlier than before the environment ecosystems available. And we invested a lot in terms of millions of ringgit in terms of trying to push digital health. But what we have learned from this lesson is, at that point of time, is managing the expectation of our stakeholders, our providers, and our population. Although it was top-down, but the technology wasn't ready then. And what we have invested, for example, we still inherit the problems in 1997. For example, in terms of our costs, you just look into a 286 computer then cost us about £1,000. And we have this vision in terms of transforming our healthcare medical records from womb to tomb, for example. And we have Malaysian Online, right? Basically, we have all the ideas, but we do not have the means to do so at that point of time because the environment wasn't ready for us. And 5 years later, he retired as a Prime Minister, but now he's back, 2018. He's never in our wildest dream that we have the oldest Prime Minister in the world, 94 years old today. And he's back because of unfinished business. So he's going to transform and continue because the environment is right now. Because today, even at the age of 94, he's very active in social media, tweeting, and he wants to transform the whole government to digital as well as digital health. I think this is a very important. But we have few guiding principles. First guiding principle is high impact, reasonable cost, good desirable outcome. Second is optimization of the resources that we have. So value for money in terms of not only evidence-based, but value-based approach. These are the few guiding principles that will take the healthcare transformation to the future. Thank you.
Thank you very much. Can I jump straight away? Because much of our digitalization discussion, and obviously because many people, when we say UHC, actually think care, not necessarily coverage and the broader issues. I'd like to turn to Katie Dane, who is the CEO of the NCD Alliance. And Katie, if you look at this whole digital agenda, what does it mean for non-communicable diseases? What does it mean for this tsunami, not only in terms of care, but also in terms of prevention?
Thanks, Ilona. So if you take the universal health coverage debate, which is what we're all focusing on this week and for the next however many years to come, there are three key things that it means from an NCD perspective. Number one, it means an urgency for prevention and health promotion. We know that we've changed from an agenda of survival to one of thriving and healthier populations. And so this is really important in terms of UHC, and it often gets dropped off the agenda. The second piece of it is really the challenge of multimorbidity. You know, multimorbidity is now becoming the norm rather than the exception, and NCDs is very much at the center of that. And then the third piece in terms of UHC and NCDs is really about the imperative of community and patient empowerment and engagement. We're not going to solve NCDs in terms of prevention and treatment unless you really empower communities and people and those affected. But let me just take the prevention part of it, because I know that most of this conversation so far has been on the care and treatment side of things. Digital health really provides an opportunity on two fronts in terms of NCD prevention, I think. It's both on the health literacy side of things as well as behavior change. And I think what the WHO ITU Be Healthy, Be Mobile initiative has shown, particularly within smoking cessation, has been really, really powerful. It not only you're able to scale and reach so many more people, 2 million people in each of the 5 countries they're focusing on in terms of cessation, but also the effectiveness with a quit rate of around 19%. And it's also obviously much cheaper. So I think the prevention and health promotion side of digital is absolutely critical from an NCD perspective, and we can't just focus on treatment and health care. Let's keep prevention on the agenda.
Thank you very much, Katie. I think we should clap for prevention as well. I'd like to actually stay in this area and move on to Joanna Ralston, who's with the World Obesity Foundation. I mean, there are many dimensions to this prevention agenda. We can use the digital, as Katie has indicated, to actually have positive health impact, but there's a heck of a lot out there that actually brings us negative health impact. So maybe around this issue of marketing, algorithms, etc., maybe you want to share some of your thoughts on that with us, Joanna.
Sure, I'd be happy to. Thanks, Ilona. I'm not going to talk to you about algorithms. Don't worry. Okay, but I am going to talk to you about marketing to children, and the childhood obesity tsunami that we're experiencing is very much influenced by marketing to children and now digital marketing to children, and it's very hard to measure and to capture. You know, children have sort of hard to access to tools that are still very unknown to us, and so there's a whole sort of world of children being exposed to children, young people, and you know the WHO definition to health harming foods, alcohol, tobacco through digital channels. And there's a tremendous need to start to try to do a better job of monitoring that. WHO has set up the CLIck standard, which stands for Comprehend the Digital Environment, Landscape Understanding, Investigate, Capture on Screen, and Knowledge Sharing, which is really trying to standardize how do we capture what is going on with children. But it also requires you know, working with agencies outside of WHO in terms of regulation, and particularly WTO, I would say, and sort of regulation and standardization of marketing to children, which obviously goes across borders. So I think that's the you know, as we're setting up UHC, this panacea for everything, thinking about those areas and really trying to set up systems for those areas so that we don't wind up 20 years hence discovering that we've allowed a very dangerous level of marketing to children to result in a much larger obesity problem than we already have. Thanks.
Thank you very much for that, Joanna. I think we already heard from this panel that at one stage we're not going to use the word digital anymore because everything will be digital, and it's just the way that we're going to do things. But there is a slight danger right now to actually, because this is so new, because it's so tempting, because it tends to really allow some solutions that we haven't had before, that we sort of talk about universal health coverage here, and we talk about digitalization here, and even in the SDG 3 action plan that is being developed, there seems to be some of that, we get a sort of new verticalization. Oh, and all the techies are going to be over here, and then, those people who really want to work with community on the ground are going to be over there. So how can we overcome this kind of new type of fragmentation? How can we work together, obviously, between the agencies, but also how can we ensure that the digital transformation is really an integral part of universal health coverage development? And we have with us Mr. Benoit Kalasa from the UNFPA. Maybe you can share with us some of your concerns or some solutions to fragmentation. And then we'll ask the Global Fund the same question.
Thank you very much. Good evening. I think I have good news. The good news is that as a global health organization, we understood first that the health sector needs to transform. I think from Astana last year, and now with the call for the global health organization to come together. So when we came together, we said, what will be new that we are going to be doing? And what will be those accelerators? And for this community, data and digital health has been chosen as an accelerator to achieving SDG 3. That is good news. Now, how do we demonstrate that we are not putting burden on government? Because all of you are going with solutions to countries, to health workers. If at the end, what we are looking for is, one, to improve performance of the health systems, two, to make sure that we take informed decisions and that we have the analytics and the data visibility for us to go to scale, then what we need is to, one, as global health organization, to say, what are we doing individually and how can we collectively go together and engage the government, not separately. I think that commitment for coordination is key. And it is key also for the private sector, because the United Nations and the Global Fund, Gavi, we are not the one producing or bringing innovation. So what we need from you now is, what is the maturity level of the technology solution that we are bringing to the countries? We don't need now to go for testing solutions. We need the solutions that are being proven. So that is also an area for coordination. I think a simple example is when you take drugs, how we take the reproductive health commodities that UNFPA work in. If you take the supply chain, and the Global Fund can talk about that, how do we link the people, the manufacturer, the processes, that when family planning commodities leave the manufacturer, we can track the commodities, and all the partners have access at the same time to the information up to the country where the goods are supposed to be there. And from there, how the government is going to bring the commodity to the last mile. And then the division of labor comes in. Who is best placed in the supply chain? So WFP coming together, Global Fund come together, UNICEF come together, UNFPA coming together. That is, I think, one value adds of the SDG 3 action plan. I think we need just to come together. It is a behavior change that we need, but also the transformation of the future of work within the sector that where we are working now. This is also part of the transformation.
Yeah. Thank you very much for that. And let's hear from Professor Osamu Kuni from the Global Fund. Exactly the same question. How do you see that? And particularly, how does it play out at country level?
Okay, thank you very much. Since I'm Japanese, when I get a microphone, I feel inclined to sing. But this time, just I try to refrain. Yeah, I think singing is much better than talking. Yeah. But anyway,
digital.
Right. Especially, I lived in Brazil, so sometimes when I listen to the music, I just all my body just swinging. But anyway, I just want to start with my experience. because coming here, before the joining the Global Fund and based in the Geneva, I was working in Somalia. It's entirely opposite world, right? And I was working in a UNICEF. And the Somalia, as you know, that it is a country with a maybe poorest, health system. And when I, traveled around in a semi-arid area, I just tried to, scale up the immunization. And I visited some of the villages from village to village. And, when I drove on, unpaved, actually there is no road. So it is a kind of arid land. And my driver, my car, hit a baby goat. And my driver just went out and picked up the mobile phone and talked with the owner of the goat. And he came back. And I said, okay, I can give some money to him. And he said, no, just finished. I sent money to him by mobile phone. It is Somalia, right? There's no bank system, but they use the mobile phone for e-banking because it is much easier. Diasporas just set all kind of mobile stations, and very easy to just scale up. And actually, the Somalia was at the time, it is more than 8 years ago, and it is the lowest the charge of the mobile phone calling from Africa to US even. So it is a really kind of that kind of rapidly moving, and I'm very much surprised. And it is a really kind of game changer. We can just perceive it as a game changer if we apply in this health field. But as you know, there are lots of fragmentation, and some people said that in this, the innovation area, 5% is just only finished in the pilot stage. No, 95% just finished in the pilot stage. So only 5% could be scaling up. So Global Fund would not invest in just pilot. We have to really kind of invest in impact. As you know, Global Fund is really always kind of matter this impact, how we can scale up and how we can show the real impact. That is why now, good news is 30 the donor and also aid agencies, including UNICEF, USAID, CDC, Global Fund, and Bill Gates Foundations, agreed and signed that donor alignment in a digital health. It includes the donor harmonization and also prioritizing that national plan which incorporates global digital goods and also track and monitor that progress and investment. So we have a very good principles. But of course, as you know, principles is just principle. How to just implement. So Global Fund is a partnership organization. It is not just a very standalone, but we are 21st century partnership, including UNFPA, UNICEF, and USAID, etc. So we are working together. Especially, we just try to be a bit prescriptive to the country, even we are respecting country ownership. But we try to make kind of mechanisms to support countries, especially developing national digital health strategy, for example, and also budgeting and several others. Yeah. So okay. So free time we can talk much more and maybe sing. Okay. Thank you very much.
Thank you. I was just going to say, just imagine the energy he'll bring when he's singing. So we will come back to you on that. You bet. Then we have our digital health party or something like that. So the Gates Foundation has been mentioned, and we have with us Dr. Oren Levine from the Bill Melinda Gates Foundation. I wonder if you'd say a bit to us how this digital transformation is also changing your organization, the priorities it's setting. And of course, one of the things that was important or is important about the foundation, that you're willing to take risks. So if you share with us a little bit in this context, primary healthcare, that the foundation is now taking up at great speed, one must say. What role does digital play, and how are you going to approach it? What are you going to fund? What do you want to see as outcomes?
Yeah, thanks for this opportunity. And I must say, I cannot hold a tune, so I'm definitely not going to sing for you people. At the foundation, it probably isn't surprising to you that we're bullish about digital and the role that it plays in strengthening primary healthcare and contributing to UHC. We're trying in our investments to take a long-term and risk-taking view. We hope to be right away, but if we're wrong for the next 5 to 10 years, to be really right in 10 to 20, then that's a risk that we're willing to take. One of the previous speakers made the point that digital is an ends or a means to an end, not an end in itself. And I think there are 3 ends that I'm really excited about with digital right now. One is serving healthcare workers better. There is flat out an energy crisis amongst healthcare workers. They spend too much time filling out paper forms. We can spare them that. A couple weeks ago, I was in Rwanda and I met community-based health workers who are the bedrock of a primary healthcare system there in Rwanda, and they spend as much time filling out paper as they do looking after clients every day. There's a financial crisis, the increasing costs that can also be helped through digital data. And then there's an equity opportunity. Inequities exist or are allowed to persist in part because people are made invisible. I think digital data helps to make invisible people visible. It's also important for gender equality. We know that there's just not enough gender deaggregated data collected right now. So it's an opportunity to work on gender equality. 4 challenges that I'd like us to think about as we go forward. One is driving strong country government ownership of their programs is key to success. We need countries that have a plan that then donors who can adhere to donor principles that have been agreed previously can make their investments into. Together, I hope we can address the 3rd challenge, which is to develop the successful business models that will spark private sector innovation to help us solve digital solutions. And then lastly, I think there's an opportunity to get more women involved. We've seen tonight already that 80% of our speakers are male. We can do better in digital and promote gender equality in digital space as well. Thank you.
Thank you. And thank you very much for that last point, so I don't have to make it. Great. So I keep saying these things. So we wrap up this panel with a sort of overview in a way. We've mentioned different types of partnerships. We've mentioned different types of tensions also, where the private sector, for example, can be a tremendous support, but also where the private sector can be a real danger. So we have with us Mr. Alan Donnelly. He's from the G20 Health and Development Partnership. He's involved in a lot of the G20 activities. So your view on partnerships after, partnerships between countries, between different parts of society, private sector, etc. Please, Alan.
Thanks, Ilona. First of all, I would like to thank Novartis and PATH for hosting this evening. They're both members of the G20 partnership and are very active members, but the work that they do promoting innovation and the work that Anne's Foundation does with people on the lowest incomes is quite extraordinary, and people really should have a look at this. And also, it was nice to hear the ministers speak again. I was at the Commonwealth Health Ministers meeting on Sunday and had the chance to hear many of you describe what you've done, and that's the operative word. It's what you've done. And I had the chance to meet with Precious yesterday to hear about the initiatives in South Africa. And the extraordinary thing is that you're making massive changes. I know Malaysia very well, and you are making massive changes. And the countries that have been describing what they've been doing, I would just say that you are role models, and people should look carefully at this. Now, I chair the G20's Health and Development Partnership, but I'd just like to read something to you, because I think we should remember the things that the head of the World Health Organization says, because he's a smart politician and he's a fine leader. And he said in March, "Since we have the broadest mandate, the only option we have to release our energy and potential is to share it with others. If we want to be stronger, give it away. That's the principle. We don't need to be paranoid and risk-averse. Let's learn to work with civil society, the private sector, and others." Now, today, Ilona and some of us sat in a lengthy meeting discussing non-communicable diseases. In my work, the work I do with the G20 Health Partnership, I do on a pro bono basis because I'm so interested in it. But in my commercial work, I do a lot of work in the financial services industry and in the automotive industry. And one of the things institutions have to understand who are dealing with health is they have to understand the speed of change that's taking place. And your comment about promoting initiatives that are going to transform health is actually at the very heart of this. This evening I met a young man from India, Aditya, who's got KNX, just met him, he's come along this evening. He's invented a device which can be linked to a mobile telephone, and it helps to identify a problem with an unborn child. And that information is then sent remotely to a gynecologist. In our partnership, as well as big organizations like Novartis and PATH, we have Pedigree, which is an entrepreneur's initiative in Africa to help people identify whether they're taking counterfeit medicines. DMI, which is an online radio broadcast, which helps people to understand, to identify malaria, to teach them about hygiene and so forth. And these are initiatives that haven't been promoted by me or the G20 or probably any of the people in this room. These are entrepreneurs who are now doing these things. And we have to understand, and the World Health Organization has to understand, and the Global Fund, who I've got enormous respect for, and they've also been partners with us recently on publishing a report. We have to understand that the private sector, micro businesses, entrepreneurs, will identify a potential problem and they will invent a solution. And we can't travel at 50 miles an hour because that's the way we've always done it in the multilateral institutions. We've got to give people like my friend here from India the support to do that. Now, in the G20 Health Partnership, we're meeting the week of the Heads of Government meeting and the first ever meeting of finance and health ministers, which we have been arguing for. And we need to take down the firewall between health ministers and finance ministers. And finance ministers need to start empowering people who are working in health to find the solutions that we need. Now, I come from the UK. I'm a proud defender, as a former Labour politician, of our National Health Service. I'm not suggesting we privatise our health service, but there is, in this particular space of NCDs, of technology, we have got to empower those people who are the inventors and who are the geniuses, because they're the people who are going to help solve the NCD problem. They're the people who are going to help ensure that we get the diagnostics and the analysis to deal with AMR and all the other crises that we've got. So my final thing, Ilona, is I'll just say it to the institutions here. Remember what your leader said in that speech in March. New partnerships. Don't be frightened to empower people. That's the way that we will make change happen in this very, very important area.
Thank you very much, Alan. And I think let's clap for both panels. And I hand back to you, Steve.
Thanks, Ilona, and thank you. I think the commitment to this multi-sector, social, private, public sector engagement on this is so valuable. So we're going to wrap. It's a long day, and a lot of people have many other places to go, and conflicts are coming up. But we wanted to close with two final thoughts. One is back to the WHO, since this is the World Health Assembly, and we are here to think about how to create a globe that works well in this area. If you have one thing, and I'm going to limit you to one thing, Bernardo, that you're going to go tell the boss, based on this conversation tonight, what's that going to be?
What a difficult question. I think, when I go back and update Dr. Tedros, I'll tell him that out of these gathering, there are 4 Ps that I take away, and also they're part of our core strategy. The first P is how do we make sure that from the policy perspective, governments, national governments, also normative agencies, how can we give our best to collaborate within the policy perspective? The second P is how, from the practitioner side, I think literacy, how can we ensure that as we go through the transformation, not just the tool works, but also the people that use the tool are literate enough to actually deliver the best result of that tool. The third P is for the producers to make sure that as we ride the hype of AI, because there's a hype of AI, how can we ensure that those areas or those tools that don't work do not deliver harm to people? And the last P, which is the most important one, is people are at the center of it. So it has to be people-centric. So I'll go back with those 4 Ps to...
So that was 1 divided by 4.
Yes. So that's the takeaway that I take out of this. Thank you.
Steve, you had a second part, you said, or no? Okay. Thank you. So yes, I thought this dialogue was really, really inspiring, and I want to thank everyone for these enriching thoughts, and which leave us going home with so many new ideas. First of all, we heard from WHO about this fantastic new digital health strategy that is gonna really help countries to get started, those countries who didn't start yet and those who are on the way, help them forward. We've heard that there's immense opportunities with digital health to increase access, quality of care, also sharing knowledge, as we heard from the ministers of Rwanda and DRC, specifically for healthcare workers who are very remotely working and who need empowerment to continue their job and clinical decision support systems. But we also heard about the challenges on the ground from South Africa, that we have to drive kilometers, thousands of kilometers to deliver these infrastructures to make sure that we can reach the whole population. And then on the other hand, the ambition of our countries is very big, because if we ask what is the first thing you want to do, you want to change everything. And I love that answer because it's true. But if there's the one thing you mentioned first, Minister Patrick, was the coordination of care and the prevention. And I do believe that is really the right choices. As prevention, we heard also from panel 2, is absolutely key in the whole debate if we want to address NCDs in order to achieve UHC, and digital health is really a good tool to do that. Well, we also find out that there's mind-blowing opportunities with innovations, like ITU is telling us that you can connect with 5G in the most remote areas of Africa thanks to satellite internet. Isn't that fabulous? I think it's really amazing. And then the new and more intensified collaboration between ITU and WHO is going to help us with developing the standards for interoperability, the national frameworks for regulatory standards, legislative standards. It's so essential. So we are very happy to hear that as well. And then in our second panel, again, we heard that the time for the whole ecosystem to be ripe to implement digital health at a scale has to be right. We see that the Prime Minister of Malaysia has to come back at 94 years old. So it was really a very good example that it has to be right. It's true, you are one of the pioneers, or maybe the pioneer, starting 20 years ago. And again, digital has to become entirely part of every health system, even to coordinate with the different UN agencies, making them all work together. We heard from UNFPA how it can increase the health system performance on the ground if the coordination happens. And then that brings me to the donor alignment principles that were signed last year and which were mentioned by our colleague from the Global Fund, who also taught us that we need to dance and sing if we get a mic in Japan. So next time we do that. And then we need to really serve our healthcare workers better. I really liked your comment on that, because it's so true that even if we now see that healthcare workers take a lot of time to address all the questions of the patients, to note them down on paper, on the computer, it takes also a lot of time. So I've seen healthcare workers looking more at their screen than at the patient, so it doesn't necessarily solve that problem. But we have to think about it and make it work better for them, absolutely. And I cannot agree more that government ownership is the condition sine qua non for success. The government has to be in the driver's seat, and so much so that if it's not the case, it's doomed to fail the digital strategy in a country. And last but not least, that we need more women. I cannot agree more either. But I also learned again a lot from Alan's last remarks on how the private sector, and specifically entrepreneurs, the micro businesses, it's so true. They are the ones that are going to find the solutions for us. They are going to be the ones who really drive these solutions. And we cannot ask them to wait that we have it all measured and well, that we know it works. We have to work in a different way and accommodate their way of working as well if we don't want to stand still and we want to get to that transformation. So I think that's really super, super important. And let's empower inventors. I noted that down, Alan. I like it. Let me end the closure of tonight by thanking very much all the teams who worked for preparing this event. And let me start by the team of PATH with Steve and Dickie. But the people who were working behind the scenes were Kate, Kathleen, Haley, Anna, and Matt. And I would love you to all give a big round of applause. As well as for our team at the Novartis Foundation, which was led for this occasion by Jason, Caroline, and Jeffrey. Thank you again. Fantastic teams, all of them fantastic teams. And a big, big thank you again to Dennis for bringing us all together here and for making this event happen. So thank you for coming. With this, you are all invited to the apéro, please. I'm sorry, I forget the most important.